You're unmuted.
Thank you. Sure. I'd like to call this meeting to order. This is the Benzie County Board of Commissioners study session. Maybe not. I guess they forgot that they're in a public meeting, huh?
Is your mic? Is your mic?
She said they're not.
Try it again.
I'd like to call this meeting to order. This is the Benzie County Commissioner Study Session. We're in the Frank Walter House Board of Commissioners room. Roll call, please.
Cunningham,
Here.
Janat,
Here.
Markey,
Here.
Nye,
Here.
Roloffs,
Here.
Powers,
Here.
Worsakki,
Here.
All present.
Can we stand for the Pledge of Allegiance, please?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We have an agenda before us.
Make a motion to approve the agenda as presented.
Cunningham, second.
Any discussion? All those in favor say aye.
Aye.
Opposed? Brings us to our first item, Sean? Oh,
No, approval of the
I
minute.
jumped quite a bit, didn't I? Just a minute, Sean. We have a meeting minutes from 12/12/23.
That
moves to approve as presented.
Second.
We got a motion support. Any further discussion? Hearing none. All those in favor say aye.
Aye.
Any opposed? Brings us to our first public comment. We have a very full room. I'm hoping someone has something to say. I'll close public comment. Now we're up to Sean. Thank you, Sean.
Thank you, ladies and gentlemen of the Board of Commissioners. I stand before you today as the president of the Benzie County Recovery Court Foundation Board, many of which are here with me today. And it's a bittersweet time because 15 or so years, maybe even more than that, the Honorable Judge Nancy Kita established the Benzie County Recovery Court here in Benzie County, recognizing a need to assist people struggling with alcoholism and a pathway to both sobriety and reestablishing their driving privileges. She created the 85th District Recovery Court. As part of that recovery court, the Benzie County Recovery Court Foundation was formed, of which Judge Kita was the president for many years. I was the treasurer towards the end, prior to her retiring, and upon Judge Kita retiring, I assumed the presidency. And when that happened, I knew that one of my largest roles was going to be to shut down this foundation. Things changed in the dynamics of the recovery court. The 85th District Court in Benzie County really ceased to exist in its form in Benzie, although it is still operating in Manistee County, and Benzie County residents still have access to those services and that help. And it would be nice at some point to see that court resume its operations in the district court. The circuit court took up the recovery court model, the specialty court model, and is functioning, as the board knows, a specialty court for circuit court felony offenders that are controlled substance related, still with a goal of really guiding people to a lifetime of healthy sobriety. When the district court, recovery court ceased to exist in its form in Benzie County, the foundation really no longer had a purpose. The state court administrator began administering grants for the operation of recovery courts. The idea of fundraising sort of at the community level to support these types of government programs really wasn't the goal moving forward. And when the Circuit Court Recovery Court established itself, it was determined that really we weren't going to be taking community money. We'd be utilizing state grants. So that brings us to today, wherein as we shut down the 501c3 that is the Recovery Court Foundation, we really want to honor Judge Kita. So Judge Kita, if you could stand and come join me. And maybe the other members of the board, Prosecutor Swanson, former Assistant Prosecutor Tang Anderson, come up and join me. They're taking pictures, so it's better if we're all together. So one of the things that we did, and as you know, a 501c3 really needs to dissolve its finances prior to dissolving or donate those finances to another nonprofit. We thought about ways to do that in other areas in the community. And what we decided was that the foundation would basically grant transportation ability for individuals suffering from substance use issues or lacking driver's license. And we would purchase Benzie bus passes so that individuals having those struggles would have access to some of that transportation. So one of the last things the foundation has done is provide those passes, and myself as the probation parole officer for Benzie County is sort of doling out those passes to people in need if needed. So the last thing that we're doing financially is to really honor Judge Kita. And we're going to present a plaque. And that plaque reads, "To the Honorable Nancy A. Kita, in recognition for the establishment of the Benzie Recovery Court in the 85th District Court on August 25th, 2008, providing the citizens of Benzie County a pathway towards a lifetime of healthy sobriety and recovery." So this plaque will hang in Judge Kita's old courtroom. That is courtroom number 2, the small courtroom, as a forever reminder of the efforts that she made. Judge Kita did not know why she would be here today, but we made every effort to bring former board members, individuals involved in the establishment of the court, and all friends and family to honor this moment. Thank you.
Thank you.
Do you have anything you want to say? Sean?
Don't want it.
Oh, yes, absolutely.
Well, it's complete with surprise, but I thank you so much, Sean, and I really appreciate all the work that so many other people did besides me to try to establish this foundation and this court, and I'm really grateful to all those people because I know it made a difference, and now it carries on. Apparently, the concept with the people that are able to participate in Manistee County as well as the circuit court folks, and it's just something that was so needed then and even more needed now with the other types of addictions that we're dealing with more than we used to. So I'm very proud to be honored today. Thank you very much and for being the surprise. And I do want to thank Sean very much for his efforts in this whole, Suzanne, other people that were involved in the board and so on, and also Rachel Whitliff, who isn't here today, but she was very involved in the district court work. And also Mike Rice was very involved in having the juvenile court portion of the recovery court. So, and there's other people, too many to mention, but I'm just so grateful that everyone is here today. And I thank you very much. I really appreciate it. It means a lot to me.
The date is the first meeting of the foundation.
Oh, yeah.
Thank you very much.
Thank you.
Thank you for your commitment to the community. It's
How does?
Now they're gone.
You could at least brought food.
Really?
What was it
I
called?
wasn't in
Lady
charge,
food?
so
Oh,
there was
okay.
no
All right.
food. The only food there when I'm, you're very good at food.
Give her a plaque.
Big family, that's what we do best. is food.
That usually makes everybody happy.
Wow. I thought we were so popular.
Yeah, don't count on it.
That's nice though.
It was very nice.
All right, let's move right along. Jackie, you want to come up and do HR updates?
I just submitted an HR update in your packet. The only thing I would like to change on here is there actually is still one employee on a medical leave. On here it says all have returned, but I recently found out one is still continuing with a medical leave. We're hiring our posting for the emergency communication specialist just closed, so hopefully we will be holding interviews in the near future. No current work comp claims. We do have a work comp audit that is due the beginning of February. We're still going through the reclassification process for non-union employees. Prosecuting attorney's office is up first, followed by the clerk's office. And then ongoing projects is everything for year end. So W-2s, 941 reporting, ACA reporting, work comp audit, non-discrimination testing. And then I have to reschedule a visit for equalization. And there's a few departments left for me to visit during my first year-ish here. And it's the sheriff's office, animal control, and prosecuting attorney's office. So I'm hoping to set that up within the next few months.
Believe it or not, Jackie's been here a year already.
A year, can you believe it? Is there any questions that you may have regarding the update?
Just the workers' comp thing.
Oh, sure.
It's current. Is that what do we have pending?
Oh, any pending ones? No. No, there's, I can talk, I don't know if this is the appropriate venue to talk about that, but if I can speak to you a little bit, further about that outside of a public meeting, but we do have an employee on light duty.
Thank you.
Mhm.
And Jackie, your ongoing projects, just for myself on
Sure.
this, non-discrimination testing data, what is that?
Sure. So part of our ACA reporting is that we have to show that we don't show discrimination when offering
Oh.
benefits. So
Okay,
it's part of a reporting that we're required to submit. And Flores, one of our vendors, actually does it on our behalf. I just provide the information to them.
okay, the data on that. And the last one, you said visits to be completed. The purpose of your visits in general are?
Well, sure. I think it's important from an HR perspective to understand what different departments do. And so coming from a place of not necessarily understanding, for example, what the sheriff's office does or the animal control, I think it's
Okay.
important to just be there. And I found it's a good way to talk to employees that may have something going on that can't quite make it down to HR. So it works out really well.
Perfect.
Yeah.
Okay, thank you very much.
Sure.
That's
And then
all.
the only other thing that we wanted to bring up, W-2s is on there. Every year we do a total compensation page. And we wanted to bring up again this year, if that's something you want us to continue to do. We've received a lot of feedback from staff that they don't like them. And so I wanted to hear from the board your thoughts on that.
They don't like the total compensation page that gives them detailed information.
They feel it's kind of a slap in the face.
Okay.
I'm
And
bringing
it's-
it up.
And it's meant to be a tool for them, right? Or information for them.
That's my understanding is by I think the board implemented it. I don't know if it was prior administration or the board, they had implemented it. And I think it was to show like a picture of what the county does for the employees. But it's our understanding that employees kind of feel like they kind of get a little like, well, why is this necessary kind of thing. So we wanted to know if that's something you want to continue to do based on feedback from the staff or not.
Oh, I'll take the bullet for that because I worked with Mitch
Okay, I
so
wasn't
that,
sure.
so the employees could understand what's the total cost of employing people.
Mhm.
But I've got to ask, and I know that you'll understand this question. Are you hearing it from the majority of the people or just have a vocal few?
I would say the majority.
I would say a majority of one, maybe two departments.
Well, even when forgive me, last year when I first started, I took on this to begin with and I made an error on some of them. So when employees were bringing them back, I got it several times. I'm not sure why we even received these. And I'm like, well, I'll get you a new one because I made an error on there. But so it was a general consensus that, I mean, this year I've heard it from more specifically a few departments, but I still remember when I first started getting all of those back. So it's just a more general question. I'm happy to complete them if that's something the board would like to continue going forward, but we thought
You
it'd
know,
be
why don't
important.
save yourself the work?
That's why we asked the question. We didn't want to not do them because I know that the board was, a big proponent of those. And so that's why we're asking you, based on staff feedback, do you want us to continue to do them or not?
Well, if you have the data.
Well, it's
Yeah.
not that easy.
Oh, okay.
Well, yeah.
That's what I didn't understand.
Yeah, it's not a report that you just pump out. There's
I
a lot
see.
of hand calculating that goes into that. That's why there were some errors on some because
Mhm.
forms weren't set up properly. So it's not just like a pump out. If it was just a pump out of the system, I think there'd be, it's much easier, but it's not. It's not.
It literally lays out all of the compensation that the county has to pay, including SUDA taxes,
Mhm.
matching taxes, pension. And,
Um,
and I would say this for speaking for myself only. Times change and maybe this isn't an effective tool anymore. I know that when I suggested it, it was an effective tool for the time,
Sure.
but I have to defer to administration. You guys are closer to it than I am.
I'm surprised. I'm just to know, I thought it was a valuable tool. I mean, when I received it, I didn't know what the county, the healthcare costs, where your retirement is at individually. I mean, this isn't information that you glean unless you're provided it annually
Mhm.
or request it.
Sure.
So I thought, it just from a person receiving one, I thought this is fantastic. To just have this information. I
I
applauded it being done.
I have to echo Rhonda on that. I mean, I thought it was personally fantastic.
Yeah.
Because throughout my entire career, I didn't always get that information.
Right.
Sure.
Sure.
But I guess I would lean if we have the majority of the employees that are saying they.
I wouldn't say majority. I would say there's a good chunk, but I don't know if I necessarily say majority of the employees. I mean, we have a lot of
more than
employees,
50.
but I would say a good chunk of staff think that it's, silly.
Interesting.
Mhm.
That's so much work because I would have seen it as a tool too for.
So the question
Educating.
I would have is not doing it would probably lighten your workload a little bit, correct?
Yes. 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 it
So-
would. Yeah.
Yeah.
It's not a trick.
If there was a
Yeah, I'm like-
streamlined approach to them that we could, pull them out of a system easily, it'd be a little different, but it's a lot of hand calculating. Not only on our behalf, but certain administrative assistants and other departments also have to do a lot of hand calculating to provide us data. Cause we have boot allowances and clothing allowances and, that all was going in part of that. And so there is a lot of hand calculating based in, our office as well as other offices to make those happen. And then, of course, then there's room for error and there's an error. And then somebody's like, well, what the heck?
So I'm inclined, I'll be done in a second. Inclined that if some people don't want it, they could just ignore it. But if you stop it and there are people that do want it,
Yeah.
they're gonna be doing well, I used to get this, where is it?
Yeah.
Mhm.
I don't think we're gonna make everybody happy.
Yeah.
That's why we're relying on you to tell us what to do.
I'm gonna defer to you guys, to be honest with you.
That's where I would.
I'm gonna offer maybe a pared down version where you don't include all the payroll taxes.
Mhm.
But if the cost of their health benefit, where their retirement's at,
Salary.
salary.
You want like their allowances included? So there's clothing allowance,
No,
boot
I-
allowance.
They know, I think.
Okay.
And the things that employees wouldn't know unless they receive this are the things like. And maybe they do know where their retirement benefits are at, but I just think it's a good thing to file away and have. And I wish I had it in front of me so I could
If we could do a pared down version, that would
Let's see
make
if
life a
that's
lot
more
easier.
acceptable to
Mhm.
everybody to say, oh, this is great, but I wish I would have had this number. I don't know. And then they could ask you individually if they
That
wanted
could-
to know
yep.
that.
But we do have a short timer with the question out there.
If she can come to the podium though, because people complain when they can't hear.
Coming from a numerical position. Many people don't understand numbers.
Right.
My suggestion is an education session about what they just received in their paycheck. If they got that and they were still offended, that's on them. But if they got that and then finally learned what that number meant to them, we've educated them. We've helped them see a different perspective on what their wage truly is, what their compensation is in total. But I think a little educating would go a long way to helping some of that.
And it would relieve.
Well, I
the
think if we did a
extra
pared
effort.
down version and it wouldn't be, you could put,
Not so color coded.
you could put something on there that said, you know who you are. If you get a food stipend or a, uniform
Yeah.
stipend or a whatever you get, you know what that extra is, and that's not included in this document. Then they don't have to dig it all up, but yet you still get the gist of retirement, health insurance, life insurance, wages.
Yeah.
That's my thought.
Does that make the task more manageable, Jackie?
Yeah, I would say so. I mean, holding an education, it's a good idea, but I don't know if doing that would make it easier. I think.
Nobody will go to it.
Yeah.
I think
If employees have questions, they can always reach out to me, but even last year, and when I completed this, no one asked a single question about it. And I don't know if it's that they don't understand it. I just think that when we present it, I think some people perceive that it's a way of saying, this is all we give you. Don't ask for more. I think that's the
No, I
perception
agree.
that
Yeah.
has been referred back to me. I don't feel that way. But that's basically in a nutshell how it's been presented back to me. And I'm happy to do it. I don't want you to think that I'm not. That's fine. It's just something that I think an informed decision should be made. I just wanted to have you guys be aware of the feedback we've received.
I agree with Art. Needs to be between these two. And my suggestion is, if somebody wants it, they can come in and ask for it. Otherwise, I would probably end it. We had the same thing at the post office. They would do this periodically, and there's a lot of people were upset. You're just trying to. And why take the headaches for it, and why do the work if it's not amounting to anything? That's where I'm kind of looking at it.
Well, and keep in mind too, on your W-2 form, a lot of that information that was on that, colorful page is reported on your W-2, the retirement we put in on your behalf is on your W-2 and so a lot of that stuff is already on your W-2. Now, making sense of a W-2 may be a little more difficult for some than others because it is kind of a weird little document. But a lot of that stuff is on your W-2. And so you are receiving a majority of that information right there on your W-2 as well. We were just, expanding upon it, color coding it, adding some explanation, putting in your boot allowance, putting in your, different things. We were adding that into there because that's the template we were left with. And so, that's what we were left with. And so, if the board says don't do it, we won't. But if you say a condensed version, we will make it much more simpler, so that it's not such a task.
What if we just say it's up to you?
Then it probably won't be done.
bingo.
So be it. My
Yeah.
support. It's, maybe this wasn't for the right reason, but learning from previous experiences, we wanted to show employees, what does it really cost to employ somebody?
Right.
It wasn't to punish anybody, but I think the number probably somewhere 40% more than what their paycheck is
It is.
what's the cost of employing. And most people don't understand that. They don't understand that you have suitor tax and matching social security taxes. If it's run its course, then so be it. But I'll repeat myself. You guys are closer to it than we are. I know that you would like to say we made the decision, but honestly, this is administrative decision. That's all.
I had brought it up when I first came on board and I was told, no, you're doing it. So that's why I brought it back to you guys. Cause I had asked before and I was told, no, you're doing it. So, that's why we're bringing it up because it wasn't an administrative decision 2 years ago.
Oh,
Yeah.
Well, and just to be clear, I don't want you to think that employees aren't thankful for their benefits and thankful for their health insurance. I hear on a regular basis that they are very grateful for everything they have. So I don't want this to make you think otherwise. I just wanted to bring it to your attention.
I think Commissioner. Knight.
Oh, sorry, go.
No, I'm pretty confident there's gonna be a few handfuls of people who do appreciate receiving that.
Mhm.
And I think, I don't want this to be a knee-jerk reaction to a couple comments that were made. I do think I love the county at a glance. We were asked that question. Should we be doing this? I think it's a valuable tool and the people that I give it to appreciate receiving it. It shows them things they don't think about, and whether they spend a little bit or a lot of time with it, it's a glimpse that I think pays for itself and shows that the county is forward thinking and being transparent. And I think it's along the same lines. We're being asked the same question. This is a burden to do. Well, can we meet on a middle ground where, or maybe just upon request, we've decided to not provide you with the information but if you would like that information, it's available upon request. I don't know. I just think if I'm asked if you would rather provide information or not provide information, I'm always going to defer to providing information.
Sure,
And I think there are people who appreciate that,
Mhm.
maybe not the ones that you hear from.
That's fair.
So maybe the answer is, make sure that the employees know that the information is available. If they
Sure.
want to ask for it, they can have it.
You got it.
Well, and one thing we could do too that maybe would help with that is we can establish that percentage. You know, Art, you said you figured the other benefits were probably about 40%. You know, that's a percentage that we had established downtown that we were just able to easily communicate to staff. Well, you know, your benefits are about 50% of your wage or what have you. And so we could try to establish that percentage so that, you know, if folks want to know, we can give them that percentage that it's a rough estimate. And then if, you know, they want more detail, we can obviously provide that. That's no issue. But we could at least establish that percentage so that we have that rough percentage of, you know, 40%, 50%, whatever it may be of someone's salary. On top of that is fringe.
and Katie, I'll tell you, this is the first that I heard that there was a lot of manual calculations that went into it.
Yeah.
I assumed that it went into a program.
If it did, it'd be really nice.
There's some things I can get from running reports, but it's accumulating the data is a lot of hand key entry.
Mhm.
I know I support what Tim said.
Great. Well, thanks so much.
Thank you. All right, our next line item here is a discussion with Sarah May and a Human Services Collaborative request.
I am gonna go ahead and share the screen because we do have a PowerPoint. I did pass the PowerPoint out to all of you this morning so that you had it, but we'll go ahead and put it on the screen as well.
Katie, what is that we had in our packet?
For this,
That's the same thing.
oh, that's for PARS. This is for the Human Services
Oh,
Collaborative.
this is human.
Yeah,
Okay.
yeah.
She handed this out this morning.
Got
It's
it.
just
Yep.
a
Thank you.
scroll. Oh,
wow.
fast.
This is going fast.
Yeah.
Okay.
Speed reading.
We'll see if I get a hang of it. Well, good afternoon. Thank you so much for having me today. I'm excited to present to you and share more about the Benzie Human Services Collaborative. Some of you might be really familiar, and I know some of you maybe have never heard of it. So I'm going to give an overview, but feel free to ask questions, and I'll make sure there's time at the end for questions. In addition to my PowerPoint, I also have a handout. And so if it's easier for you to kind of follow along, the handout helps to summarize everything that I'm going to go through. But I'm here today because the Benzie Human Services Collaborative has been around for quite a few decades, and we really are in need of support. And so we are seeking support from the county commissioners for $3,000 annually. So I want to go over what we are as HSC, what benefit we bring to the community, and how important it is for us to sustain the work that we are doing. And no,
Here, you want me to do it?
there, okay. I'm looking at my computer that's not moving. Okay, so our vision is a caring community that nurtures and supports families to succeed. We are a group of several different agencies that all serve Benzie County residents and open to all different kinds of community representatives, nonprofits, governments, and even business. Our mission is we are dedicated to building on the strengths of our community through a collaborative process. So really bringing everyone to the table to work together on these complex social issues. We're really rooted in the human services agencies. That is what our name means, and that's what we're all about. So a little bit of background. This organization started back in 1987. 16 members came together. They were agency service directors that came together because they realized that all of them were dealing with similar issues, and they thought it would be better to collaborate and connect together. Then back in the 1990s, around 1996, the federal and state funding called Strong Family Safe Children came into existence. And so they gave each of these state endorsed county collaboratives funding that they had to disperse in their community as they prioritized. And so that really kind of strengthened and gave the structure to our Benzie HSC. And so they developed a 5-year community plan at that time. We received about $120,000 that supported the coordinator, which is my role, with the HSC, as well as then they identified these different programs that they wanted to implement, especially prevention programs dealing with trying to strengthen families and strengthen youth development. And so that's what the funding was put towards. And then they identified different community service barriers that was happening. And so they developed work groups that were focused on certain issues. And so I kind of listed there some of the original work groups that were started, including early childhood, and transportation was one of them. And so I'm sure you guys are all very familiar with Benzie Bus. So before Benzie Bus, we had this transportation work group, and they really identified the need for public transit in Benzie County, which helped lead to the support of the millage to create Benzie Bus. So that's just one example of how working together has improved our county. So the structure of the HSC is we have an executive committee that is overseeing it. So we have a chair and vice chair. Then we have all the members who are welcome to attend the monthly meetings. And I am kind of the glue that connects everything as the coordinator, keeps the communication going. And then we have identified work groups that work on those specific topic areas. Whoops. Okay. The work group priorities, or some of the priorities in general of the HSC, were the no wrong door policy. So that was so no matter what agency you went to, that they were informed about what resources were available throughout the community and could give you that referral and that connection to the other people. And I'm on the wrong thing here. It's also really important that we reduce the duplication of services. So being informed about what other agencies are doing really helps you to know what you don't need to invent. If it's already there, you need to connect to the resource and not duplicate. So that is a main priority, and addressing different barriers there are to receiving those community services. Okay.
Did you just jump ahead quite a
I
bit?
know.
Yeah, here, I'm gonna,
It's a very sensitive mouse.
I'm gonna.
Go back to,
All right. Here?
right there.
Okay.
Yeah.
I'll just do it that way.
Okay. Thank you, Katie.
Yeah.
So what we do is educate. So at our monthly meetings, we always have a speaker to present on a topic. Usually it's either a new program or a resource that's available in our community, or updating us on an annual report from an agency, just so we're all informed of what is happening and what is going on. We connect with each other, so that's really important to develop those relationships with one another. So we know that if we have a client that, is in need of this or that, we can refer them to a person, not just to the agency, and have that trust and connection with each other. And then, of course, we collaborate to maximize our resources. So if we're able to create a program, it's great to see how the agencies can depend on each other. I think Bacon is a great example of they really connect with other agencies. So Michigan Works, which helps with career and job development, doesn't have much of a place in Benzie County or a separate office, but they can use the space, at Bacon to be that for the community. So it's a really great way, especially for such a small county like Benzie, to use these regional entities to have some space and connect with them right here locally. Next slide. Just again, to reiterate, our membership is open to all citizens, consumers, and agency providers. We have lots of people who attend right here from Benzie County, but we also have a lot of regional entities that work in Benzie County, and so they can still participate with us, which is great. We meet monthly, the fourth Wednesday of the month. Karen Cunningham is our representative from the county commissioners. We meet from 9 to 10:30. Typically at Grow Benzie. However, in the wintertime, we do virtual meetings because you never know when the big snowstorm's coming. And so I just kind of shared some of the members who are part of the HSC. Some are more active than others, but we really tried to cast to get everybody involved. It really started with the three main agencies: Department of Health and Human Services, Community Mental Health, which is Central Wellness Network, and the Health Department. So those were the three key agencies, and it kind of has grown out of that to include all the nonprofits and all different human services agencies, as well as a lot of county folks too. This is our executive committee. Karen Goodman, who is from Central Wellness Network, she serves as our chair. Josh Stoltz from Grow Benzie serves as our vice chair. And then we have representatives from the Health Department, DHHS, and MCAA, and Bacon also on our executive committee. Goals for 2024. So we're taking on a big project this year. Our main goal is to redo our community resource guide. It was developed originally in the early 2000s, and I have worked to try to keep it updated, and just the format of it is very challenging to work with. And a lot of things have changed from 2000 to now. So it's going to get a whole new revamping, and I think it'll be a much easier way for community members to see the listings of food pantries or other things. We are really fortunate. We do have 211, which is a great resource that you can get connections to different community resources and services, but it sometimes is a little tricky if people don't know what they're searching for. You have to word it exactly a certain way. So this will be hopefully an easier way for people to see what are our local resources here. This can really help, especially agency workers who maybe are new to the community, as well as the general community members. We really will hope to have this on several different websites, like links to it from like the Benzie County website, from Bacon, and from other organizations in our community. Another goal is our members wanted a pictorial directory, so we get to know each other better and can see the pictures and know more about what position everyone has in their agencies. Just because we only meet monthly, sometimes it's hard to really get to know people. So we're going to work on that. Just continue our monthly meetings and continue to strengthen our work groups. So I'm going to go over what our work groups are, what they focus on, and some of their accomplishments. And just let me know, Katie, if you want me to kind of go quickly here, because I don't know how much time you guys have, so. But our first work group is the Benzie 0 to 6 work group. I've been really active in this. Has been chair for the last several years, as well as now Sue Campana has stepped up to take a leadership role with it. But this, as it says in its title, is really geared towards early childhood. So we're really focused on how can we connect young families with the resources we have for early childhood. In particular, childcare has been our number one issue that we've been trying to address and look into. And we have a great diverse group of people who are part of this. We have people who are really passionate about early literacy, education, the Great Start Collaborative, Head Start, Benzie Lynn Health Department, Central Wellness. It's really great to have all those partners at the table. And some of the accomplishments, we were one of 6 recipients of the Rural Child Care Innovation Program. So we got to work with consultants with First Children's Finance to develop a community solutions plan that was all geared towards childcare. And so we have developed that plan and created this initiative called CARE for Benzie. CARE stands for Childcare and Access and Resources for Everyone. And so with that initiative, we have started what's called early childhood booster groups. And we've worked with 3 local churches to match them up with a local center or home provider. And they provide quarterly support, kind of a nice thing to do for those daycare centers. So one example is when Whistle Stop Learning Center just opened in Thompsonville. They really needed people to assemble furniture for them. And so a group from St. Andrew's Presbyterian Church came out to her center and they put together furniture. It was such a huge help for the director there. She really appreciated it. So it's really more about helping the childcare workers themselves, because in our research, we realized they don't get a lot of pay. They don't get a lot of recognition in the community. So this was a way to know that they are valued and are supported. We are working right now on starting, it's called the Family Childcare Network. And that is slow going, but it's trying to bring all the home care providers together to give them some extra education and kind of support for each other, peer support. Benzie Cares for Kids was formerly known as the Child Abuse Prevention Council. And actually, it was kind of neat to see Nancy Kita here because I know she was part of that a long time ago. And so that is all about, of course, strengthening families and preventing child abuse. It's really connected with the Children's Trust Fund, which is now called the Children's Trust Michigan. And we really look to support local efforts that are really ensuring that our children are safe. Safe sleep is a main priority, as well as those concrete supports that our baby pantries provide, like formula and diapers to our young families. Another great thing, so this gets a little confusing, but Benzie Cares for Kids really works closely with our Benzie Family Services work group. And we provide, so Benzie Cares for Kids is kind of like the fiduciary that provides a lot of these camp scholarships, but our Family Services work group are the ones that actually fill out the camp scholarships and they approve them. So they kind of, there's a lot of connective things, as well as if you've ever attended the Thompsonville Summerfest, is an event that happens in June in Thompsonville. It hadn't happened for a couple of years since COVID, but last year, Deb Frisbee took that on and we had a great turnout for that. That is supported by Benzie Cares for Kids. Okay, so going on to the Benzie Family Services Work Group. This one is really geared towards families, as you can tell, and we have, again, a great cross-section of people who are working with families across the county, and they come together really trying to identify where are the gaps and to see if we can find resources and support for each other. Again, this work group with Benzie Cares for Kids provided those 14 camp scholarships, which was so exciting to give, that gave local Benzie County youth the opportunity to attend a summer camp program One that we awarded was to a teen mom, and that was just an incredible thing to offer. We've also helped youth in the past that are connected with a juvenile court for them to attend a summer camp, which has been fantastic. Another role that this team serves is the community team, I guess it's called, for the wraparound service program. So wraparound services are, it's a program that's done by Central Wellness Network, and that is really geared towards preventing a family like losing their child to foster care, so preserving the family. So it's a very intense, high-risk program that they're working closely with. And so what our work group does is if there are any resources that that family needs, the worker who's working with that family can come to our group and just ask if there is, if that resource is available in any of our agencies. So that has definitely helped a lot of families. And then the Benzie Area Youth Initiative, I head this up as a facilitator in another part-time role that I have. So it's a little separate, but I report on it every month with the collaborative, so I included it in here. This is connected to reducing youth substance use. And I believe it was started by the sheriff when it initially began back in 2015. We are also about promoting mental well-being in youth as well, because those are very connected with substance use. This past year, we have really been active with doing a vaping prevention campaign via social media. So we've been putting out a lot of Facebook posts and then as well as TikTok posts. So that way we're getting the youth audience as well as the parents and others. We put on the Screenagers Under the Influence event at the Garden Theater, and now are working with both schools to show it to all the middle and high schoolers in the county. And you can see lots of other things that we're doing with that group. Community Center, I kind of briefly mentioned this before, that really is all about doing that Thompsonville Summerfest event. Deb Frisbee has now taken that over, and it was just really well attended last year. I think we had over 300 people and 40 different county organizations were represented there. So these are affiliated collaboratives. They're not direct work groups with the HSC. I listed them because there is so much overlap, and all these people are part of our collaborative. So Best Benzie County, if you're familiar with that, is our educational network. Manistee Benzie Kinship Care Coalition is something that's newly formed that's really looking at providing care for the kinship families. And then the Northwest Michigan Coalition and Homelessness is a much broader 10-county initiative, but we are part of it in Benzie County. So that brings me to the budget and numbers, right? So we do all this with a really small budget, under $20,000. Most of our funding comes from our membership dues. So those are dues directly from all the member agencies that participate. However, agencies are not required to provide dues because we do not want to. We understand that some very small nonprofits are not going to be able to provide anything. So it's not a requirement, but it's highly encouraged. And we also get some support from grants. And then we have built up some savings that we can also use if we don't get enough in our membership dues. So on this budget, it's a little bit, we usually only receive around $11,000 in our membership dues. So when I put 14,000, we are hopeful of getting some new members and some support from the county to make the budget work for this year. And then you can see the majority of the expenses is really going for the coordination. That is for my staff time towards this collaborative. And then a little bit for family services. That is a very small fund for last resort funding to help provide a need for a family. The administrative is more like, room space for the meetings and some bookkeeping, and general services is more like office supplies and meeting supplies. So that brings me today to the proposal for that $3,000. That was determined based off of what they give in Manistee County. They give $3,000. And I talked to Rose, who is the Manistee HSCB coordinator yesterday. She said she doesn't know how long they've been doing it because it was before she started in that position. So I'm guessing it's been over 10 years that they've probably been doing that. And I know Leelanau County also gives support to their collaborative as well. So it is, I think, a result from when those Strong Family Safe Children dollars went away, that a lot of the collaboratives that have still remained active were able to get some county funding to help sustain them. So I am happy to answer any questions that you guys might have. I know I went kind of quickly through it all, so feel free to ask.
Sarah, do you
Yeah.
have a real feeling of how this benefits, the collaborative benefits the county as a whole?
Yeah, what I really have seen is especially just receiving that knowledge and being updated with what's happening in all the different agencies. Then when they come to, let's say, Bacon, the staff at Bacon are aware that there's this program, for instance, like the WIC program at the health department. And with that encouragement, they're able to get that family not only the help that they can receive from Bacon, which is very limited, but they can get this other help that can maybe be more ongoing, that kind of thing. So there's lots of different emails that I get to about, like, is there any help for head lice, or these really random things that nobody might know. So it's really important that we have this network so we can ask those questions and get people connected to those resources.
And
Thank you, Karen.
And having been on the committee for this year, that's what I saw was the greatest value in it. And they're very good at not duplicating, but connecting people. And people don't know where to go. So having Bacon, people know to go to Bacon, or a lot of people do. And for them to be able to pass that information on, it really centralizes it, and that's the value. And I know that's a lot of that is on you as the coordinator for it, but that's what I've seen in the group. How do you pick your focus point speakers?
So the executive committee helps to come up with kind of maybe a topic area or something that's a priority that we want to make sure we cover. So coming up this month, we're going to talk about the Benzie Broadband Initiative, which I bet you guys are really familiar with as well. And then last month we had Maggie Bacon came from Best Benzie County, and I know they've been doing a lot of listening sessions through NMC talking about post-secondary opportunities there possibly. And so it's really amazing to have this group of the HSC to be kind of the ones that are working with a lot of people who may be underemployed or unemployed or struggling in some way, have that idea of, okay, if this came to Benzie County, how could we connect these people? What are their barriers? Just a better sense of understanding how that could fit together.
And one of the things with childcare being one of the main concerns that was brought up through the survey that the county did a couple years ago. You have addressed that quite a bit in this, and having Sue Campana and doing this resource guide, and for it to be available digitally, or I don't know if it's going to be in print somewhere or not, but the group is great for those connections. So hats off to you guys on that.
Thank you. Other
Sir,
questions?
what connection do you have, if any, with the Northwest Michigan Community Action Agency?
Yeah, they are part of our group. They're very active. They have lots of different kind of departments. So they have that kind of housing and budget counseling, money management department, as well as they also oversee the Head Start and Early Head Start programs. So we've had people in all those different aspects of the department.
So it looks like you're in a competing environment on early childhood. The Action Agency provides it, and I heard you say you provide it also.
We do not provide any childhood, no. We just have a group dedicated to, I mean, they are part of that group of the Benzie 0 to 6 work group. So
Okay.
it's all the early childhood people coming together. Maybe you got confused about, I said we were going to start the Family Childcare Network. All that is bringing home daycare providers together to kind of support each other.
Okay.
Yeah,
Yeah,
not in a starting a program or anything.
So I talked to Chip yesterday about this because he happened to be at the building and we were talking about the collaborative and, you know, how it came about and those sorts of things. And Chip was very supportive of the collaborative in both counties and all over and talked about, you know, the big reason for it was to be sure that we weren't duplicating efforts as well as is to catch some of those bad players, surprisingly. He said what would happen is you know, folks would go to all these agencies and ask for the same types of services, and there was no collaboration and communication to figure out, oh, well, we're already providing this service to this family. You don't need to, you can provide it to another family. And so this really brought everybody around the table to make sure that we were coordinating services appropriately and individually in a sense of not duplicating the services given to the same family, making sure that we were spreading the wealth in the county. And so Chip was talking about that and how that's very important for the counties to do and how he's been part of this collaborative for years, Central Wellness has, and how he was very supportive of it as well.
Yeah, I plan on having that conversation at our next Central Wellness meeting.
Mhm.
Just Karen is, you know, at Central Wellness, and so is Chip. You have many of your participants are, I mean, I hate to use the term heavy hitters, but they have significant budgets, Central Wellness and the health department and DHHS, and they have budgets that we provide money to annually. So I guess I'm just wondering, you know, you had membership dues on there, but they have general funds as well, and they're direct participants. And then I know Bacon is really philanthropically supported. Have any of these options been considered for perhaps looking for more input monetarily?
So yeah, those agencies do provide the membership dues. But like I said, all that only totals about $11,000. So it's not meeting our budget. And so if we can get some appropriation from the county as well, and I would say that would be kind of considered when I talk to Rose and Manistee, the county commissioners there kind of see that as helping to fund the county agencies or people to attend these meetings and participate and benefit from it, is how they see that funding. But in addition to that, all those other agencies still, you know, provide dues to the HSCB and Manistee because it takes more like 20,000 to make it work.
And it's my understanding too, Benzie County used to give monetarily to the group. But along the way of, you know, Benzie's budget shortfalls, it sounds like it was taken out. But it's my understanding that at one time the county used to give an allocation and then it went away.
Does a community action agency, do they pay dues?
Yes.
'Cause I didn't see them listed up here as one of your partners.
NMCAA,
Was it up there and I missed it?
I
Yeah,
think
they're
it was
listed.
It's
listed,
in there.
yes, yeah.
Okay, thank you.
Mhm.
Any other questions?
Yeah, the Board of Health,
Mhm.
do they pay dues? I mean, I
mean, the health
see
department
some of the
does.
stuff you're doing is a duplication of community connections
Of course.
and other things and which originally was a DHHS requirement. Actually, DHHS is probably could be doing some of this stuff, so. And then you mentioned, can't remember.
Centra, but I also see Josh Stoltz on there, and with the Grow Benzie piece of this puzzle, I mean, every time that he speaks to us, he reinforces the fact that he wants to be the resource, the convener, I mean, I always envision the wheel. He wants to be the hub, and then the spokes go out to all the resources where Grow Benzie is, you know, sending people in the right direction. And so I guess in my mind, this is one of the spokes that leads to something that Grow Benzie wants to do, to provide resources. But along Gary's lines, it almost seems like
This is a little different and it would be very good for you to speak to Chip about that.
Good.
Do that on
Because
Thursday.
this is a little different in the sense of, state statutory, other things happening. That this is specific to the 3 prime members, addition to those others that come involved. Whereas, Josh is part of that and helping to be the backbone of that a little bit, but really the purpose of this organization, there's a higher written document defining what this group starts out as.
Yeah, and just to clarify, yeah, Grow Benzie is really involved, and actually Grow Benzie kind of came out of the HSC, like that organization was formed from it. And so we as an organization don't have any legal status on our own. So Grow Benzie is our backbone organization. They serve as our 501c3 and do provide us that meeting space and that bookkeeping, which is really critical. So we're more the collaborative, bringing all the different agencies together, where Grow Benzie is really trying to kind of build like certain programs and initiatives, give that backbone support. Hopefully that clarifies it. And then going back to Community Connections. So we have tons of overlap with Community Connections. Deb Aldrich, who is in charge of it, is part of all of our meetings, as well as a lot of her community health workers. So what we're providing, they're doing the actual work, right, of actually connecting, going to a person's house, doing the home visiting, connecting that person to the resource. What we're providing is like that work group space of the family services. So when their community health worker is trying to find this resource for their family and they don't know where to look, they can come to us, and we as a collective group can share our wisdom and resources with each other. So it's kind of just overall giving them that support and that knowledge and greater understanding.
Just remembered what I forgot, and that was the WIC program.
Oh.
That to me should not be that difficult to navigate on your own even. I don't like to see duplication of services. I'm seeing Benzie, Grow Benzie, and I'm sure he'll be back. He already told us he would be back, asking for funds. So I really need this clarified, and I'm having a rough time with it. Thank you.
What do you need clarified?
Where does it end? How do we?
Oh, it's probably never gonna end.
I guess I need to talk
Organizations
to
come
some
to
folks
counties
from
all the
Mass
time.
too. I can call some of their board members.
Areas you're concerned about overlap of services?
I don't like funding things 3 and 4 times.
Yeah.
Maybe that's my concern. And no, Deb, I've been on the health board for close to 10 years, so I know everybody that's on this list and I know what they do and how they do it. I just don't, a lot of this stuff could be handled by going to a health board meeting or something like that to find out what's available, or we could supply that information here at not a huge cost.
So part of it, Gary, is that this organization started off by like preventing people from having to go to Central Wellness or to the health department because there were people cherry picking and going to all 3 of these departments and getting services, duplication of services. So this organization is stopping the duplication of services.
And that's how Chip explained it to us yesterday.
Yeah.
Is that was the big importance of this once upon a time, was to stop that from happening. I don't, we can provide information to community members, absolutely, but really the purpose of this one is for those administrators to find those resources. So this group is coming together, not with individual citizens who need help necessarily. It's with those administrators who are like, it's that bench of network for those administrators and those, staff persons so that they can provide their service better. It's kind of, they're a network of each other. So they can go, they can call up Sarah and say, hey, what was that? Where do I point this person so that they can provide their service better? It's like me when I'm calling county administrators and like, how did you do that? So I can, maybe copy it here. It's that network really is what I see this collaborative serving as, is that bigger network.
I was always left with the impression that one of the purposes of the organization is that they were cross-pollinating information from agency to agency,
Mhm.
but that's not what the purpose of that.
I think it's a little of both. I mean, it's network and it's,
Right, it's to foster those relationships and those trust. So like, but the HSC collaborative, like I'm just the only staff member and I work very part-time. So I am not creating a specific program to like run a day camp for kids. But this is bringing those issues up. So they see like there is this gap and this need. Let's get some funding, and why doesn't Bacon connect with Benzie Senior Resources and provide those senior food bags, right? So it's just, they were meeting at these meetings and they came up with, there's that need, so it kind of happens along the side sometimes, those side conversations as well as more directly. But just a good example of, we have a representative from the faith community from the Ministerial Association, and she was working with a community member that had some financial needs and her church was supporting this family. And then she connected with me and said, are there any resources for budget counseling or money management? And so I was able to get her that information. So then she knew also to help this family in the long term, if they can get connected to that NMCAA support, that can really benefit them much more than just this one-time, gift that she's able to give.
Yeah, my understanding was correct then. How much does a member typically contribute each year in dues?
So it is based on their annual, there's a fee structure and it's based on their annual budgets. So for those smaller organizations, it's as little as $150, and then it goes up to $6,000 for a partner organization. We only have one that is in that $6,000 amount. So the typical agency usually gives between $250 and $600 is where most of them fall under that category.
Who's contributing 6,000?
Central Wellness,
How much does Action Agency contribute?
$250.
Dollars?
Mhm.
Thought it was based on their budget.
Because they are a regional entity, that's what they give. So that is what we can't require because of our operating guidelines. We do not require them to pay a specific due.
Okay.
So this is what we offer, the suggested amount, and they give what they find is appropriate.
It's all voluntary is what you're saying?
Yeah.
And Gary, just to answer, I've heard a couple of times in this discussion about people having resources. I've worked with low income and indigent people for a number of years. And honestly, they really don't know where to go. The first thing they'll go to is the HHS,
Right.
because they all seem to know about that. But to think that they would come into the government center looking for information, that's very unlikely. These folks really do struggle. Most of them don't even know about 211. In fact, I'll bet a lot of you didn't know about 211. And so I get that they have to have a place to go to understand where they can get help from. Bacon has been filling that role for a number of years too.
Right.
Well, if they reach out to DHHS, they will automatically go to the health department because of community connections.
Okay.
Yeah, that need for navigation, because it's a complex system. And so for someone who's maybe dealing with a lot of other issues, single mom, having other crises, it's really hard to be able to do this. So Community Connections provides that navigation for people to fill out those forms and get that support. That's really important.
I understand correctly that folks still need to go to an agency to receive resources, whether it's Central Wellness or the Health Department or Bacon. What the collaborative does though, is it meets once a month for an hour and a half to try and understand what the other organizations offer. So if the person comes in and says, I need this, and well, we don't provide that, but they do. So they can't go to the human collaborative,
Correct.
right?
Right.
That's just a meeting once a month.
Right. And that is, we usually have, a topic, a presentation, but then we always do end with the opportunity that everyone goes around and shares an update, a need, an example of something that they maybe are doing that's a collaborative effort with everybody. So that way they are informed. I also provide an e-newsletter every month that kind of gives a summary of some either upcoming trainings or events or things that are happening, like for instance, the Toys for Tots Christmas store that's available, so they are aware. you know, I'm working with this family. I need to encourage them to enroll into that program. But yeah, we're not directly providing that. It's through our partners are doing those.
I guess the last comment I'll make is, I believe that we should probably help you in some level financially. What that number is, I'm not sure. We ask a county commissioner to sit on that board. Karen, I'll bet shows up religiously, and I don't know who had it before that. But, you know, if we're gonna be a partner, then we need to be a partner. I don't know if 3,000 is the right number, but, you know, I'd be supportive of doing something.
Wonderful. Thank you.
Well, I'm one voice. And you're gonna find out it's not very influential. So.
Anything else? Otherwise, thank you so much for your time. I really appreciate it. It was wonderful to be with you today.
Thank you.
Thanks, Sarah.
And our next item on the agenda is discussion regarding the PARS program.
So about a month and a half ago, we had representatives here from an organization representing the PARS program, and I have included a great deal of information in your packet about this. As a reminder, this is a public trust fund makeup, which helps you pay your unfunded liabilities, helping to level out those payments to your unfunded liability. As talked about at that meeting, you know, they don't have much of a footprint in Michigan yet, but they're hoping to grow that, but they do have a footprint in other states. The idea of setting up this trust is to set money aside, and then it stabilizes those pension payments, pension unfunded liability payments that we're making to MERS over the years. You can set up a timeline on this trust. It could be for 15 years, 30 years, or what have you. And we would decide how much money is put into that fund. And then, you know, if the pension liability goes to zero, as in 100% funded, you know, the trust fund could then be, you know, at its expiration, the money would come back to the county. I know that there were some other ideas about maybe we somehow set this up to manage it on our own. We could talk about that. Do we want to go for this program? Do we not? Are we happy with how we're doing things? Are we not? Shelley is here to really be part of the conversation as to what is the board thinking? Did you like that conversation that those individuals had? Do you want to pursue something like this? Or do you want to keep with the status quo? Someone's got a Samsung phone trying to access our TVs.
Well, I guess nobody wants to respond yet.
Just let it ride then?
Well, is there an additional cost for us to do this?
Yeah, we would, if we set up this trust, I mean, there's administrative fees and, you know, it's based on how much you actually have in it. You know, so I can't give you a dollar amount per se.
Well, what I'm getting at is, so we already have a liability to begin with.
Correct.
And all this is gonna do for us, my understanding is, making it so we could forecast going forward, for budgeting purposes. But there's a cost attached to that to make it so we can have continuity in our budgeting forecasts.
Yes, sir.
That's why I'm more in favor of finding a model where we handle it in-house. I mean, we know Michigan plat class is, the interest rate is 5.46%. Pardon? Until it isn't, correct, but then there's also options for CDs. I mean, you can have growth on money that sits there. I think the thing that has distracted me, has deterred me from wanting to make lump sum payments, which some believe work in other areas, is, and I think those people called it, what they call it, the great abyss.
Something like that,
Something
yeah.
like that. You're throwing a chunk of money in a great abyss. And especially finding out after the fact, after we've made many of those contributions, that unless we earmark that to go towards the principal or some sort of designation, it can be used in whatever manner they chose. Or that was a deterrent. That was frustrating. But I do think that at the times where we have a surplus or we have marijuana money, the conversation always goes to, should we make a MERS contribution? Well, if we could set that money aside and put it in some place where it's going to grow, where it's earmarked for leveling out where our payment should be, at least we have control and we're not making additional payments to manage the money.
I guess the piece that I would add to this, Tim, is that two things. One is we can contribute to the money to them. We can get it back anytime we want. We send it to MERS, we can't.
Correct.
And I'm left with the impression they believe that they can get a higher rate of return than what MERS is getting also.
Mhm.
That doesn't mean I'm in favor of this, by the way. I don't want to be the first one in the state of Michigan.
Yeah, Rochester is apparently coming on board with them, but they've already been doing something of the similar in-house, I believe. They've been kind of managing some sort of program in-house, and then they're coming on board with this group is my understanding. And then I think they said maybe City of Detroit is coming on
They
as
said
well.
City of Detroit. Well, I
Yeah.
specifically asked it
Yeah.
because they kept saying Rochester and Detroit.
Yeah,
But then I specifically asked and they're like, well, they're not actually clients.
yeah,
They're
okay.
just doing the program. So yeah, I
Right.
don't want to be.
So maybe there is a
They're
way,
from California, right? Is there anybody else that does it? They
right?
jump right in bed with the first one.
Yeah.
But
Well, that's why I wanted to hear from you. I told them I would bring it back. I told you I would bring it back. That's what I'm looking to hear from you is,
If you're asking how you use your time, speaking for myself only again, I'm a no vote on this.
okay.
So
Would you want us to pursue some sort of idea internal or just keep with the status quo?
well, based on the feedback that we got in the last 12 months or so, that it'd take about 15 years, but we should be fully funded. As long as we're staying in that trajectory, I'm comfortable.
Mhm.
We're in compliance with being, at least at the moment, 68% funded, whatever that'll be at
Mhm.
the end of the year. To use your expression, status quo for me.
Okay.
Do we know what our unfunded liability is?
So,
7 million?
hold on, actually, I have these pulled up.
Pretty close.
That'll be pretty close.
So we won't get our actuarial until later, May, June-ish. Based on the last one, we're 68% funded. Let's see here. Doesn't really tell me on these.
It was about $7 to $8 million, Gary.
Yeah.
I would prefer we do something on our own,
Mm.
but we have to be consistent.
Yes.
I still look at this as, Art disagrees with me. I look at this as paying the minimum payment on a credit card. And all of a sudden, there'll come a day of reckoning. Half the sheriff's department decides to retire, the day's coming quicker than you think. Saying,
I'm sorry, go ahead, please.
No, I just, your analogy of paying the minimum, I mean, the flip side of that is, making a chunk payment to pay it off, but they don't apply it to the principal. I mean, that's what we've been doing. It hasn't been smart.
well, I agree with you. If we can set up some account that we can make the call,
Mm-hmm.
but I think we can do it in-house.
Let's see, unfunded. It's about 16 million.
16 million.
Says unfunded accrued liability as of the last actuarial. Based on future rate of returns of 5% is 16 million, 6% is 12 million, 7% is 8.5 million. So they set it in various smoothing.
Their last projections were, they said about a 7% return.
So then it would be about 8.5 million if you
Yeah.
went off that 7%.
kills me is if I said, all right, here's 8 million. Well, no, you still owe.
And that's exactly what it would be.
It's happened. People have bonded for this.
Grand Traverse County.
Municipalities have bonded for this and then realized when they hand them the money, they're still behind. So
Yeah,
It's a tough call.
If you're gonna bond it, you have to completely close the fund. And so right now we did a soft close, and so new employees aren't eligible, but existing as well as transfer employees stay within the pension. So we did a soft close, whereas a lot of municipalities said, nope, we're closed, everybody's moving. And so Benzie didn't do that. And when you guys did do that, you allowed it to stay open for transferred employees as well. So if you're moving around departments and such, you get to stay within those pensions and move to those closed pension plans of that new department.
Well, I would never consider a bond.
No, I
That's-
wouldn't
I
either.
would think the whole board would not.
I know MERS has been around a long time. I know that they're used by the majority of the municipalities. But since I've been sitting on this board, I've had my issues with them. You know, they can, for one thing, I'm not sure how they invest their money, but it's terribly conservative. Because they always underperform the market in the last 7 years that I've been sitting here. They can, anytime they want, they can adjust the longevity of the employee. It's always been complicated for me. I think there's a better way to do it.
Mhm.
That's why, Gary, I'm not as concerned when I hear a number like 16 million or 8 million. I can get that number to say whatever I want.
You can. Well, and we were just notified yesterday as well that MERS is planning to move their, a lot of their back end investing administration to Voya from where it's at now. Voya is the, overarching company who manages the state retirements and the judges and such. Supposedly this will be cheaper operating expenses, but I don't know if, humbly, I don't think that'll be reflected onto the counties and cities. But that's what they're claiming is it's going to be cheaper to operate and manage everybody's funds. And so that's why they're moving to the Voya system. So it'll be a different investment strategy and such. In a perfect world, to me, that should show benefit to all of us. But I quite frankly don't trust that it will.
So
Everybody but besides Karen had the benefit of hearing from the MERS representative who came, was that last year?
Yeah, it was
You
in
here,
November.
when they came?
I was here for PARS.
Yeah,
MERS, but not MERS.
yeah, not
Okay.
MERS.
Can we do that annually?
Yeah, I can
mean,
have them
think
come
we all
back.
heard the same thing, that in, I believe it was 18 years, and that was a year ago, we would be 100% funded without making additional payments. Did everybody hear the same thing?
yes,
Mm-hmm.
That what Tony told you? I don't recall.
Whoever did the presentation,
Yeah.
Usually
because
Tony.
I pressed them on it.
I know.
Mhm.
And
It
I
was
think we
Tony.
I think we should have that presentation annually.
But they'll do just like Art said, they'll change the.
They'll make that number what they want.
Vacation.
Well,
They'll
then
rotate
explain it to us. Well, I mean, I just want the opportunity to get more educated,
Yeah,
have a better understanding, and unless they're in here physically, and he answered questions.
Mhm.
And even the hard questions, he answered, like, where did our lump payments go? Why didn't that change your graph? When years X, Y, and Z, we made additional payments. And he didn't have an answer.
Never does.
I think,
I think you just volunteered to go to the next MERS conference.
you don't want to go.
I think Rhonda's request is perfectly reasonable.
I can have
Any of
Tony
you
to come
have,
back.
any of you could probably do annual reviews on your own investments, on your insurance
You
and,
can look out the window and see my investment.
yeah, don't tell me.
I
And in
will,
the meantime, if we could take the marijuana money or the surplus or the amounts that we're not allocating to capital fund, which is always a smart thing to do, and set a, what's the A word, Shelley? In the budget, a certain fund.
Assigned?
It's not earmarked.
assigned
Allocated.
An assigned fund or
or
restricted.
yeah, a
Where
restricted
it's
fund though.
interest bearing, whether we put it in CDs or an interest bearing account and it's accruing money, but that's its purpose is to sit there. Maybe we put it there by resolution, so if we needed it, we could get it out by resolution. Maybe a super majority to do it. I don't know, but there's a way to plan for the future where we can all feel more comfortable than we do right now.
Mhm.
Like concept.
And we are planning for the future. We make payments into it all the time.
Right?
We do. And our actuarial actually helps us project the payments. So and I did correct them after the presentation. We're never just caught with like oh crap, because the actuarial does project our payments for the next 2 years in every actuarial. So we are able to plan that flat amount because all but I think one of the pensions is a flat amount. So we're able to plan those dollar amounts. So it's not I think in some states it's oh crap, it goes from $1 million to 600,000 to 18 million, but here under the MERS plan, they do give us that number as a projection.
Okay, and then we set this fund to the side, so if there is a difference, that's where we go.
Yeah, so
before
you
we
as a
go.
board could set a base amount of like, okay, we're always gonna take, we're always gonna take 800,000. whatever. We're always gonna take 500,000 from the general fund. That's it. And whatever's above 500,000 comes from wherever. And if it's below, great. You could say that, whatever number you want it to be, you could say, you know, this is all that comes from the general fund. Anything different would come from whatever fund.
And I would suggest that we make it a percentage, a formula, rather than a hard dollar
Yeah.
amount, because that fluctuates. I'd also be concerned about putting it into a restricted fund, because it makes it harder to use it when needed.
Mhm,
But all those things are good plans,
mhm.
and we can work towards it on our own. And one of the reasons why we don't see these peaks and valleys right now is because MERS went to what they refer to as a smoothing effect.
Yes.
So yeah, they used to have peaks and valleys. They don't have that anymore.
Correct, yeah. So just looking at our recent actuarial, which was given to us, you know, last late spring. So for this fiscal year,
Which is never a current snapshot, right? It's
no,
never-
it's always like
It's
6
yeah.
to 8 to,
Right.
yeah, behind. So our total. Sorry, I gotta find the correct table. Our total contribution is 872,000, give or take, or no, 825,000, give or take, for this annual year is what we're projected. And then it lets us know that for next year, it's gonna be 909. So we can plan for those different numbers. Now, it does go up and down every year, so it's a little bit annoying because it'll be 825, then 909, then 825. It does go back and forth. You'd think they'd kind of level those things out, but they don't. But we are able to at least plan based on the last 4 quarters of reports. So I can pull the quarterly reports. Only one of the last 4 quarters was there a deficit in what we put in versus what was paid out and invested. So I am feeling fairly good in what our unfunded liability ratio is going to be when we do get it, because 3 of the 4 quarters, we came out ahead.
That just depends on how many people are drawing, correct?
Yeah, and what's invested and how much is coming out for administrative, which is also a percentage, and there's a lot that goes into it. But yes, it's how many retirees do we have? Was there any deaths? Was there any this? What, you know, so there is that, of course,
I
because we
think-
have one group, for instance, that only has 1 active employee left in it. And so, you know, that one really could be easily fully funded because there's 1 employee in it. And so it also makes things interesting on the bookkeeping side, because when Benzie County set them up, they set them up as flat rates. And so the county pays a flat rate for this plan, and that flat rate is split up between all the active employees to account for the budgeting. And when there's 1 employee, it looks like that employee has like a $3,000 contribution, when really they don't. It's because the plan itself has a flat rate, and they're the only last standing active employee to assign it to.
Do they share the predicted mortality rates?
Let's see.
You're trying to speed things up.
I just
I know.
Actually,
That's what
actually,
COVID was for.
exactly.
It
that should
doesn't
go
have
down.
it in here.
Right.
Yeah. Let me see, death. It's not noted in here.
They would give it.
Yeah, I'm sure they would tell you. I mean, they're gonna tell you, yeah, everybody's living longer in, you know.
That's gonna be curious to know now that the numbers for
Yeah,
COVID have come
down.
out.
Yeah.
Oh, hold on, maybe I can find it.
And
Amazingly, it'll be
Nope.
no different.
I'm sure. But also, Gary, the other piece is if they're projecting a 7% return and suddenly they got a 4%, that could put you into a deficit too.
Mm-hmm.
Because they're not only using your contribution and what's withdrawn, but part of your contribution is growth. And like I said, I don't know where they invest this money, but sure always underperforms. And I don't expect them to perform at the market level because there's more risk inherent in that. But there's pension plans that perform better. Because of what you're restricted to invest in. Yeah.
And that's a good thing to ask Tony. What are they restricted? Because I swear when I went to one of the MERS conferences, they own a coffee plantation in Brazil. And
Well, and the last
Serious.
MERS conference told us too that they're expanding into, was it China?
I wouldn't.
Yeah.
Bitcoin.
So, yeah, probably. So based on what I receive in there, you know, it just says large cap stock, mid cap stock, small cap stock, international stock, emerging market stock. So it doesn't give me individual, it kind of gives me those big broad, you know, where things are being invested. And international stock, it's
I'm sure you can
Yeah.
dive down into the
0.98%.
details if you wanted to.
right. So,
I guarantee you, all their investments are about preserving capital.
oh,
or
I'm sure.
Preserving principal.
Like an other or a miscellaneous line in a.
Do they
budget.
include their administrative cost?
So by switching to this new agency, the Voya, they believe that, let's see, their operating expense will decrease from 0.85% to 0.63%. Is what they say.
And that means that Voya they'll manage their investments for them.
That's my understanding is that a lot of the plans are moving to Voya. But not all the plans, only some of the plans is how this is spelled out. And Voya is the one who manages a lot of the state retirements and specifically the judges. We report through a Voya system, every payroll for Judge Mead,
So MERS is really just the administrator.
pretty much, yeah.
Okay.
So what I am hearing from this group is thanks, but no thanks on the PARS program. And let's come up with some creative way internally for us to manage this, as well as to invite Tony back. I think as the timing goes, I'll invite him back when the actuarial is ready so that we can go over that actuarial with him.
Yeah, and
that
I
sound
do
good?
appreciate that. And I remember ours when they presented,
Mm-hmm.
not very scientific to say, but looking at the board, we weren't fighting.
Yeah, I didn't really see much of a,
Yeah,
yeah.
protection and benefit.
Mm-hmm.
Yeah.
I thought it was a bit confusing, number one. And secondly, as I said earlier, and I think Evan said it himself, I just don't want to be the first one in.
Yes.
Well, and
think
that
they're
was
banking-
part of the questions.
My
Okay.
takeaway was they were banking on being a better alternative than MERS. I mean, it just,
Yeah.
it provided some, stability.
Mm-hmm.
And I think that's what municipalities are looking at when they're dealing with MERS.
Well, and I think for municipalities who maybe have a much greater issue at hand than Benzie County, I mean, you have been so good and diligent and responsible about, you know, monitoring that unfunded ratio and making sure we're not dipping low and those other things. And so I'm guessing, you know, they make more sense for some of those larger municipalities who have a much greater unfunded liability. But in the grand scheme of it, Benzie's pretty small. I know my marching orders.
Well, yeah, I was say sounds pretty clear to me. I mean, unless somebody on the board disagrees.
Great. I'll schedule Tony and we'll be good.
All right, we're moving on. Got a last public comment? I'm gonna close public comment. Motion to support. Got a motion support.